Hi there. Today I'm going to show you how I would recommend you set up your medication module so that you can see the most information in a single glance. And so how you do this is you arrange columns. There are so many columns that you can choose from, but I'm going to show you the ones that I recommend. So you may see a grid here, a little gear on your medication module bar here. If you don't, go to this little arrow here and you'll see something that says Grid Preferences, and you'll click it. And these are the columns that we're going to display. So we want to go to Set Columns to Display. So what you do is you move the available columns over from the left to the right, and I would recommend that you set it up as such. So status should be first, and that would be active, inactive, or pending. If you use samples, you might want to include the sample column, and it will just show here in the med module. If you don't use samples, you can always remove it. I'm going to bring it back, just so that I have it back where I want it. And you notice that I had it there. I'm going to then move it back up to where it was. There. I want it right there. Okay. Last audit is really what was done to the prescription. Was it e-prescribed, in which case last audit would say ERX? Was it printed? Was it forced to fax? Or was it blank, meaning that the medication was simply entered into the medication module? It might have been ordered elsewhere, for example. Then quantity, this is really important. This is the last quantity that was entered for this medication. The last time somebody did something with this medication, this is the quantity that was prescribed. Refill, same thing. Start date is actually the last time the prescription was updated or e-prescribed or refilled or entered. You can skip refill status. I'm working on that one. Note, I have this here just as this brings over the note from medication reconciliation. If you don't like this there, you can simply move it away. Medication name, pretty obvious. SIG is the instructions. The provider is the provider who last did something to that prescription. You can forget these prior authorization status ones for now. Stop date and the original start date. And like I said, you can move them over from the left to the right and then just use the move up and move down arrows to get them in the position. So the ones that I would definitely recommend in this order is status, last audit, quantity, refills, start date, medication name, SIG, provider, okay? And all the others you can play with, okay? Once you have it, you're going to say okay. And this is where you can change the size of the column so that you can see the most amount of information in a single glance, okay? So I'm going to show you how this works. So here I can see the active medications. If there were a sample, you would see yes in the column. Last audit, I'm going to make this a little bigger so I can see it. Last audit, if it were printed, e-prescribed, this is a test patient, so not many things were e-prescribed. Then the last time someone did something for this medication. So for example, if I'm going to refill this clonazepam, I'm going to renew it. The date will update to today, and you'll notice that my name will come here as the provider who last did anything to that prescription. So this is really helpful. So if a patient calls and says, I need a refill for medication, and you see that it was e-prescribed, you can say when it was last e-prescribed, for how many, and with how many refills, okay? Lots of great information in this medication module. If you have any questions, please contact us at NextGenHealth at greaterportlandhealth.org. Take care.